You. The doctor and I will be just continuing our discussion on ADHD and in adults, in particular, the consequences that can occur from people who have ADHD, whether it's treatment or not, or particularly where it's non-treated. Doctor, how does that usually manifest? I think we've covered some of this as an adult, but what are the greatest consequences of ADHD in adulthood?
Well, welcome everybody. Welcome, Vince. Nice to be with you again. And I'm really excited to continue this talk about ADHD because it's one of the most unrecognized disorders, and one of those disorders that, because of the lack of recognition, tends to create multitude of issues. Right. So you need to understand that in the movie of a human being, there's two types of people with attention deficit disorder as adults: those who never knew they had it. Actually, there's three. Let me correct that. Those who never knew they had it, those who knew they had it but was never treated because of cultural, social, biological reasons, and then the ones who actually got treated as youngsters, right? And each one of those groups are going to have some differences and some similarities, right? So, before we get into how it affects the adults, we have to remind everybody that if you have a child with attention deficit disorder, there's two things you have to do. You have to identify and you need to treat. If the illness is severe enough to cause dysfunction, it needs treatment, and the treatment is biological, psychological, and social, right? But when we get into talking about adults, usually we start seeing some of the consequences after they graduate from high school. And there's a slight difference between boys and girls. Boys and girls start showing the consequences a lot during high school, and girls tend to start showing them in college. And I think it has to do with the degree of impulsivity, hyperactivity that we see in these situations. These are not absolutes. We have girls who present symptoms in high school and in middle school and in grade school, and we have boys who don't present a lot of symptoms until they go to college. But at the end of the day, we're talking about the importance of paying attention and problem solving, right? To develop as a human being. So if we're going to talk about the areas that get problematic, once you're not treated or you're not treated properly, we're talking about areas of learning, okay, our areas of relationships, and areas of risk taking. Those are kind of the primary three areas where we have issues. And of course, learning becomes very evident, right? Especially when you're in organized learning, like high school, middle school, college, you start seeing that the failure on learning the information and utilizing the information to problem solve, right? So if you have something blocking your ability to receive the information, obviously you're going to have difficulty problem solving with the information that you didn't register, right?
So not hearing all the directions, basically, if we were to put it in very layman's terms, or at least all the directives, because of the inability to focus. So you have partial information, and you start making decisions based on that. Now that seems it would be have real profound effect when someone becomes an adult and starts in the working world.
Yeah, let me give you an example. A girl who graduated from high school, and I'm not trying to be chauvinistic in a reverse way, but the reality is that girls tend to have better social skills than
Hmm.
boys do because the need of from adolescence is different during your growth. So because they're social, they tend to share more, not only emotionally but learning, and they tend to be more willing to accept help. So if they have enough structure at home, they're going to be able to get by, right? With whatever information they're able to collect and learn, and they graduate from high school. But when they hit college, that support system disappears. And they start having a lot of difficulty getting organized. They start procrastinating a lot. They have a lot of difficulty with their grades. They start to fail. And then after the first semester or the second semester, they come back home to visit the family and they're totally demoralized. They
Hmm.
actually look depressed. and they complain how bad they feel about themselves, they're failing, and not unusually they go to see their family doctor or the internist or a therapist, and they get labeled with having depression, right? And I always like to tell parents that if you have a child that comes back from college being demoralized because of inability to learn, they can certainly be depressed, they can certainly be anxious, but they can certainly also have attention deficit hyperactivity disorder and needs to be explored, right? So that
S-
becomes important.
So, do you think oftentimes that becomes improperly diagnosed? Again, they more focus on the resultant demoralization and depression, and not the actual source of it.
Yes. You see, when you have grown up with the idea that you're not able to perform at the level of most other people, that's going to create serious self esteem issues, right? Because you're not going to be getting the same feedback from yourself and your environment that you are doing the right thing. And because of that, we have to recognize that lack of self esteem can come from a lot of different places. And
Mhm.
one of the places is your inability to perform, whether it's on learning or actually on work, right? So, not unusually, the inability to learn becomes an inability to perform in a job, right? Now, fortunately, most people with attention deficit disorder are of average and above average intelligence, right? Some people with attention deficit disorder are very smart, so they can get by like an average person because they're very smart, but eventually become overwhelmed because as you grow older, the demands from your environment require more multitasking, right? And that becomes overwhelming and it starts being manifested in very serious problems with relationships, whether the relationships are at work or at home.
So it's interesting. So I remember a friend of mine who was also a psychiatrist telling me that when he was diagnosing some adults with ADHD who did not get diagnosed as children or treated, including a gentleman who was actually a physician, but he was working in the county hospital. And he said it was very consistent that a lot of these people, because they have so much challenges, start developing some avoidant behavior. And even though he was very smart and made it through med school, he was trying to hide away in the county system so that people wouldn't see some of his faltering. Is that a common occurrence?
Yes. It is very common among people with untreated attention deficit disorder who are very smart and who've been able to succeed in some areas of their life to have grown with some idea of negative self image, lack of self confidence, difficulty with remembering past failures, right? So they become very protective of their little turf in
Hmm.
which they feel most comfortable working. So they're not necessarily people who would want to change too much because they've gotten good at hyper focusing on one area, right? But even if you're able to succeed in one area, that doesn't mean that you're going to succeed at your relationships at home, or that you're going to succeed at your relationships with your coworkers, or that you're going to be able to take the risk of social interaction with the rest of the world. So it's very isolating to have attention deficit hyperactivity disorder. And the people who can tell you that a lot is their significant others. I mean, from my perspective, when I'm treating somebody with attention deficit disorder or evaluating someone, I always like to talk to the significant other because they can actually recite to you all the problems related to their relationship, right? Because it affects them in their parenting if they have children. It affects them in their financial risk taking and decision making. It affects them on how they manage situations at home. Uh, it becomes very difficult for them to problem solve in terms of family conflicts and situations like that. So it's a situation that if you have, for example, a couple in which one of the members has attention deficit hyperactivity disorder and you try to split responsibilities and chores, it becomes very problematic. And I have patients like that in which The one with attention deficit disorder never finishes anything. If it
Oh
starts
yeah.
something,
I can wander around my house on certain days and see what my wife has been doing, but there's always one or two things left. There's like a little trail of crumbs. You mentioned before that they tend to hyper focus on things. I know. Again, my wife very much so does. So you don't see a lot of polymaths that are ADHD, or is that not true?
not necessarily. I mean, you have some people who have learned to master more than one task, right? And there are certain tasks that they do that is actually one really global task that inside has a multitude of tasks.
Okay, interesting.
Video games is one of those major things because in video games you have to be shifting attention a lot within the context of one environment, right? So they can shift the attention, but if you make the environment too wide, they get lost. So the way
Interesting.
they deal with that is by becoming retractive, avoidant, and if you talk to people who live with a partner with attention deficit hyperactivity disorder, sometimes they're childlike, right? In terms of their their answers, their decision making. I mean, if you talk to a kid with attention deficit disorder and you ask them, "Have you washed the dishes?" And they haven't washed the dishes, they're gonna impulsively tell you something.
Mm,
It may not be totally sensible. It's like the 3-year old, got caught at the supermarket with a candy bar, right?
mhm,
And you tell him, "Put back that candy bar," and the kid says, "What candy bar?" Well, the one you have in your hand. That's attention deficit disorder too, right?
mhm,
That they impulsively respond without problem solving, because the purpose of answering to that request is to push you away, is to just leave me alone. It's kind of a way of saying, don't intrude into my space right now. And that's something that if we are dealing with adults with attention deficit hyperactivity disorder, we need to be very cognizant of that, because a lot of conflicts can evolve from our inability to understand who we're living with.
interesting. So in the workplace, they can accomplish some things, but they're usually, like I said, very compartmentalized or very focused. You mentioned the issues with relationships. What is the typical thing that you hear? Like you said, when you talk to the partner, you hear the list of issues. What is that list that they typically tell you?
Well, usually what happens in the relationship is that the person who that does not have attention deficit disorder, okay, quite often misinterprets how the communication is happening. And it can be very confusing because you follow a pattern of problem solving, and all of a sudden they're giving you responses or participation that is neither consistent and sometimes not logical, right? So that creates conflict.
Could you
So
give us an example of that?
let me give you an example, and I think we talked about this the other day. And this seriously affects intimacy, right? Because patients with attention deficit disorder may look very distant, okay, or they may look excessively close, right? They may get to a point that they get clingy with you, and you become the things they hyper focus on, and then eventually they go away, and it's like they don't exist. If you don't understand that, then you start perceiving them as um, either being manipulative, give and take type of situation, or you may say, he only loves me or she only loves me when he needs me for something, right? Because when they get disconnected from you, they connect to something else. It doesn't
Interesting.
mean that they don't care about you. It just means that they're not connected to you at that moment. And if you take that personally, that creates a lot of conflict because there's going to be a reaction to what they're doing, right? So this is going to sound kind of weird, but if you live with somebody who has attention and hyperactivity disorder, first thing you need to understand is that it's not about you. It's about the other person. That's rule number one. Rule number two is that you need to be empathic to their difficulties, right?
Mm,
That this is not malicious. They're not rejecting. They're not being critical of you. They're just utilizing whatever skills they have to maintain some degree of communication. Now, unfortunately, because they have to utilize a lot of energy of maintaining um, their boundaries at work and the communication at work, when they get to you at home as a couple, they're exhausted.
Yeah.
You're not going to get the best of them in terms of attention, concentration, and empathy, right? Now, you cannot be expecting empathy back all the time, because usually what happens is that you don't hug me anymore. You just want to be in front of the video game, or you only want to be in front of your phone testing with your friends, or whatever it is, that helps you stay focused on something. So when you start taking it personally, that creates a lot of animosity and miscommunication, and in the wrong circumstances, it can turn into aggression.
Mm.
Most of the time, verbal aggression, but it can turn into physical violence too. So you have to make sure that if you start recognizing that your partner has difficulty with attention and concentration, has difficulty performing at work, it always gets passed on for promotions, you know, and you start to notice that this is affecting his or her self-esteem, and his relationship with the family and isolating. A lot of things could be happening. But one of the things that may be happening too is attention deficit hyperactivity disorder that was never recognized.
Mm. And you've said the past when we had discussions and in some of the articles we've written that a lot of other mental illnesses, bipolar depression, certain other things, have a lot of similarities, or sometimes get mixed up, and the diagnosis gets uh, um, done incorrectly. What tell us a little bit about that. What are the most common things that people think? Because I know personally of a person who used to be a patient of yours who said was convinced they had ADHD, turned out I had something completely different.
Well, you see, I'm going to try to make this simple, even though it's very complicated.
I know it is. I tend to do that. I'm sorry. I open up the
When
can of worms. What can I say?
you did, and that might be just a topic for another program, but let me try to simplify. When we talk about mental illness, right, it sounds as if we know exactly which part of the brain is causing the mental disorder, right? There are very few mental disorders that we know specifically this area of the brain is misfiring, for example, right? So if you look at our Bible of psychiatric symptoms called the DSM, Diagnostic Statistical Manual of Mental Disorders, you're going to see that if you look at 10 different disorders, or the most common ones, there's a lot of overlap of symptoms. So there are symptoms of bipolar disorder that overlap with attention deficit disorder and vice versa, depression, anxiety, OCD, PTSD. So when you start looking at all these things, what we start to realize is that the symptoms that we're seeing are coming from different parts of the brain, and the disorders are very complex, right? So then we utilize a term called comorbidity, meaning that we usually have a primary diagnosis and associated disorders, right? So not unusually, a patient with attention deficit hyperactivity disorder would have during childhood the disorder, but it may also have oppositional defiant behavior as a result of the lack of impulse control, may also have social anxiety and rejection from the social environment, may have generalized anxiety disorder, may have episodes of depression. So comorbidity is more of a rule than the exception. Our challenge is to identify what is the primary disorder, what is the primary disorder doing to this individual, and how can we improve functionality, right? Hence the need for comprehensive treatment, meaning medications for symptom control, psychotherapy for personal and cognitive rehabilitation, and social rehabilitation to improve social skills. That's the treatment. So if you translate that into an adult, not unusually, an adult with attention deficit disorder will manifest symptoms of depression, lots of symptoms of anxiety, okay, lots of symptoms of personality issues in terms of social avoidance, in terms of lack of impulse control, and so on. So when we assess somebody, it's very easy. It's very easy to say, "Well, you have attention deficit hyperactivity disorder. It takes 2 pills and call me in the morning." It's not like that for two reasons. When you're treating an adult, that adult either got treated and stopped treatment during childhood and requires continued treatment, or was never diagnosed and never recognized as a child, or was recognized and never treated, right? So, but when they get to you, they have developed a way of being, right? They have developed a personality as a result and contaminated by the symptoms they had during the whole movie, from the time they were born to now. So we have to recognize that in some patients, they have developed ways of coping that we may not necessarily want to change, right? Because that's how they became adaptive.
Mm.
Right? Um, last week we talked about the percentage of people with attention deficit disorder that occupies space in the U.S. prison system, right? And unfortunately, those are the most severe cases that translated into impulsive, frequent, and repetitive criminal behavior. So they were never recognized, they were never treated, they had other psychological and genetic issues, and they end up in prison. The ones we see are the ones who did not.
Mm.
And they did not for a reason. They did not ended up in a serious life circumstance because they had somewhat adapted growing up, right, with no significant effects on um, abuse, neglect, or things of that sort. They had some good values instilled in them as they were growing up, and they made an effort, right? And they made it despite the deficits. But those deficits will continue and may have a serious impact as you decide to have a more steady life. You may feel limited. So, you have to remember when we talk about attention deficit hyperactivity disorder, per se, use that disorder, that in itself is a disability.
So how does one? So let's say I assume that I'm a person who has found some of those methods to adapt to get through. I'm in my mid 30s or early 40s, seeing that life just never seems to cut me a break. How would somebody actually recognize that they potentially have ADHD instead of just being a non-performer or whatever else could occur? Because again, that's really difficult. I've watched people who have been significantly underemployed simply because of little quirks or things that have affected them. What would an adult who says, well, maybe this is the reason? What are their steps to find out if they are an adult with ADHD?
Well, I think that if you're in a relationship, okay, whether it's marriage or you've been living together with someone for a very long time, don't feel that them telling you something about your attention and lack of organization and procrastination is a criticism, right? So first, and this is difficult for people with attention deficit hyperactivity disorder, first you have to be willing to take some criticism and turning into something positive. And then you have to raise the question, okay, so if I do have something like this, what is it doing to my life? And that is a very difficult introspective process that requires a lot of honesty, right? Because it's very easy to fool ourselves. Well, nothing, I mean, and I hear this all the time, nothing is happening to me. I have a wife, I have 3 children, I have a job. So this is not doing anything to my life. And then I bring the partner and say, what is it doing to your life, right?
Mm.
How is it affecting the relationship? How is your husband or wife or partner interacting with the rest of the family, right? Uh, is he socially isolated? So the honesty comes from the ability to recognize that your life goes beyond you, and that is a particularly difficult with people with attention deficit disorder. I have to tell you, probably. 80% of the patients that come to me with a suspicion of attention deficit disorder usually initially came to the attention of someone because of their partner, not
Mm,
because of themselves. I would say the other 20% probably because of problems at work, right? Where somebody recognizes at work that things aren't going well. Now, because relationship seems to be one of the most serious complications of untreated ADHD, then we have to recognize that if you have a partner, you may have to go into couples therapy. It's not just, you can't just come into the picture and say, my partner has attention deficit hyperactivity disorder. He needs to fix it so he can make my life better. Because interaction is a long term process, and balance is going to require learning new ways of dealing with things. And couples therapy can help with that. I'm not saying that it is a responsibility of the partner to fix things, but if you as a partner have chosen to be with this person, right, then you have to do whatever you can to make it functional, right?
mm,
Because criticizing, rejecting the person because they're either too intense or because they're not paying attention to you, you know. So and sometimes I tell the partner, when you tell him or her to clean the kitchen or when you tell them to get the garbage out, okay, you having an expectation of that other person paying attention. They can't. It's not that they don't want to. It's not that they wake up in the morning saying, "Today I'm not going to pay attention." They cannot pay attention. So
mm,
that if you perceive it as a malicious rejection of your wanting to share responsibilities, then you already failed
mm.
because it's like telling someone without arms, "Can you pass me the salt?" Right?
Gotcha.
They can't. So we have to do everything we can to help them develop the skills psychologically, cognitively, medications to improve their attention span, and recognize that a lot of the treatments for attention deficit hyperactivity disorder work the best when whether children or adults are not at home.
Mm,
So if you're the father of a child or a mother of a child with attention deficit disorder, the teacher is going to get a better child than you because by the time the kid gets to home, most of the effect of the medication is out. Right.
interesting.
Same thing happens with adults.
So, if the main issues being at work, relationships, is there any association with physical health and longevity?
Yes, there is. Actually, because of the impulsivity, there are complications associated with attention deficit hyperactivity disorder that have to do with drinking. It has to do with drugs. Okay, it had to be of compulsive eating. So all of these matters are going to shorten your lifespan. There's some signals that just having attention deficit hyperactivity disorder may shorten your lifespan, but we don't know enough. We don't have enough data to support that. But the consequences will have health consequences that go beyond what is happening to you in relationships. Now, you asked a minute ago, what else can they do? And the other thing they can do is look for professional help. You don't have to go to a psychiatrist. Most of the people that we see in psychiatry, except for children, but in the adult side, they usually get referred to us by either a psychologist, a master's level therapist, a primary care physician, because they want a more specialized way of treating it. And because they may not have the tools necessary to do more objective measurement of the attention span. And there are tests available that we can utilize, like the QB test I would mention before, that you can actually measure the attention, put it together with the whole gamut of symptoms the patient is having, and come up with a more solid diagnosis.
Okay, so it sounds like for the consequences really are just once as kind of with all the disorders and mental illnesses, it's more about dysfunction than anything else.
Well, at the end of the day, that's our business, right? Everybody thinks that we're in the business of prescribing medications to treat symptoms. No, we're in the business of helping people live functional lives. Okay, whether it's because of diabetes or because of depression. If our treatments and interventions are not translating into the patient being more functional and adaptive, then we're not doing our jobs.
That's a good thing to know. And of course, we have to do our part as patients, or if you're a patient, whether it's with medication, taking them consistently, doing the therapies, working with our significant other, and as you mentioned, maybe the entire family when it comes to adult ADHD. Well, once again, doctor, really appreciate the information. Hopefully, everybody out there, we had a couple comments. Will like, subscribe, and share, and we'll talk to you again next week.
Hey, thank you. We'll see you soon. Take care.